Mr. Schechter, why don't you tell us how do you feel the community is impacted by this conference, and what are some of the key important parts that you feel?
There's a saying among seniors, aging isn't for cowards. You get up there, you're faced with challenges. You're faced with the challenge of your personal care and your own health. You're faced with the problem of finding a place to live. You want to remain, in many cases, in your community and not an age in place is the term of art that people use. But on the other hand, there's the problem of loneliness, the problem of being able to fit into a community when you may be faced with new physical difficulties. So then you have to consider whether some kind of congregate living is a solution for you. There's a problem of your economic status. There's a problem of paying for health care at a time when health care becomes of enormous importance to you. There's a problem of personal relationships. Loneliness is a consistent problem among many seniors. Relationship with your own families. So these are the kinds of issues that the conference, from its very beginning, I was at the very first conference years ago, has attempted to address. And it has grown because it has successfully given information to seniors. And I want to emphasize, not only to seniors, but to others who are concerned with seniors, because one speaks of the sandwich generation, middle-aged people who are concerned about their children, but also concerned about their parents. Well, they're really part of the senior community.
Well,
and
you're representing AARP, correct?
Oh, yes. AARP becomes one of the important vehicles because it deals with public policy, but it also deals with personal fitness and health care and personal responsibility for health care, and attempts to develop programs that enable seniors who want to work to continue to work. It has a varied program. And it's interesting, AARP is not only the largest organization in America, it's the largest organization in the history of America. And that represents, in a sense, a recognition by seniors themselves of the importance of participating in community life and in meeting their own problems. And it also represents the growth of the senior population. People who are population experts speak of cohorts of population. The fastest growing cohort of the American population are people over the age of 85, percentage-wise. We celebrate in senior residences every year birthday anniversaries of people who've reached 100. Now that's successful living.
Yes, and this conference is going to be about successful aging as well.
Exactly, and that's the title of this conference this year in 2010. How to master the problems of growing older, how families can help in mastering those problems, and how an individual can take personal responsibility in meeting those problems. So I think that this conference that has been successfully developed here in Pasadena, and you know, it's unique to Pasadena. There's not another city in the state of California, and I don't think of the whole country, that has sponsored and organized a conference of this magnitude with such great level of participation by the community and by seniors themselves. So it's a wonderful place to be.
And you've been involved on the national level, which I'd like to get to a little bit later. We definitely want to recognize that Kaiser Permanente is a presenting sponsor of this conference and has positively affected the lives of many people in this community, of course. And leading into that, Dr. Wong, what do you feel are some of the important community issues that physicians at Kaiser Permanente feel are important on aging, successful aging?
Well, I think, Mr. Schechter, you mentioned a couple important points, and one is loneliness. And we know that there are studies that show isolation can actually contribute to depression and memory problems. And so as a physician in Kaiser, I have the opportunity, I make home visits for patients, I go out to facilities, and so I really try to meet my patients where they're at. And I think that's very important. And actually, it's one function of the conference also is that not only is there education provided, but it's a forum to meet other people and to share ideas and to congregate. And I think that is a lot of value for the conference as well.
Now, any of the workshops, will people be able to learn about hospice and palliative care, what that is, and how to be prepared for that?
Yeah, there actually is a conference on the 5 Wishes program, which is really a national initiative to talk about the wishes that you would want for yourself at the end of life. And that's something important to me is allowing advocacy for yourself and determining how you want that time to look like so that you're able to impact that time in your life. So there'll be more information about that initiative.
Okay. All right. So any other words on the community impact from who stepped over?
With your leadership too, we've had almost 1,000 people attending, correct?
Yeah, we had 1,400 register last year, and it continues to grow. And thanks to the help of Kaiser and AARP and others, I think it's going to continue to flourish. One workshop we're giving is on the wise use of medication, doctor, because so many seniors sometimes they mix up their medications, and that causes even worse problems. So we are going to give a workshop on the wise use of medication.
Dr. Wong and I definitely have experienced that in our practices.
I'm sure, yeah.
Well, what other communities are you? Yeah, we talked before about how this is going to probably broaden into other communities that may not have this type of conference.
Well, we touch and we invite people from the entire San Gabriel Valley, Arcadia, Sierra Madre, Glendale, and of course Altadena, a number of cities that come to the conference, and I think that's important that we reach out, and I think people benefit from it. So Pasadena is the host of it, of course.
You know, one thing that should be emphasized about this conference, it's a wonderful social occasion. It's the biggest lunchroom in America, I think.
Right. Yeah, there's lunch available too.
There is lunch available.
Yeah, well, with the help, because of the sponsorship of Kaiser and AARP and the city of Pasadena, we're able to provide a free lunch to every participant. And so you have this wonderful array of people at the Church of the Nazarene, of 1,500 perhaps people, mostly seniors, but other people concerned with seniors, having lunch together. And it's a wonderful social occasion. And that's very important in the senior community, to communicate and to be part of a group of people where you can discuss mutual problems, raise the issues that you're concerned about, but also meet people and
keeping
participate.
Your mind and body active.
And you know, Pasadena is a wonderful community because it's such a diverse community. My wife and I moved here nearly 50 years ago because this was a unique community, a cultural heritage, a heritage of a diverse population, a city that pays attention to health care. It's one of the only 3 cities in the entire state of California that has its own health department. Now that's unique. Pasadena takes responsibility.
Tell us what the importance of that is.
Pardon me?
Tell us what the importance of that is.
Well, when a city or a community takes responsibility for the well-being of all of its citizens, including those who are facing economic difficulties, that's a measure of the health of that community. And Pasadena has that, particularly in the healthcare. I was pleased to see the City Council of Pasadena taking position on healthcare reform in Washington. They endorsed healthcare reform. Why? Because they saw it was valuable, because they saw it was an important issue for the whole country, and they saw it as an important issue for the well-being of the people of Pasadena. And I think that the city's sponsorship, together with AARP and Kaiser and many other organizations of this conference, is another demonstration of a consistent welfare or well-being concept that the city takes responsibility for all of its citizens.
And you bring up another good point in that hopefully with Kaiser Permanente and AARP participating in a conference like this that has positively impacted the community for the past 8 years, they're serving as a role model for other organizations, medical and non-medical, in making a difference in the community and holding such conferences, providing information to the public, and making a difference in healthcare, not only locally, but nationally.